By Alyssa Story. CalMattersMedical student Allison Leggett knows the power of her presence as a Black health professional. During her clinical training, she met a young patient with social developmental delays, who was very sick and spent a lot of time in the hospital alone because her father, her sole caretaker, worked 3 jobs. At first I thought she didn't like me, but when I told her it was my last day and I was, said Leggett afterwards, her dad pulled me aside and told me, "I don't think you realize how much of an impact you made on her." That moment also had an impact on Leggett, who realized how representation at the bedside can put a family at ease. Having a Black physician on the team really made him feel comfortable, especially since he couldn't be there all the time advocating for his daughter, and he really felt like we were taking care of his baby girl, she said. He was extremely scared, but he knew we were fighting for him and for her. As a student, Leggett wants to fight for the community that raised her, which is why she began her medical career at Charles Drew University of Medicine and Science in Los Angeles, California's only historically Black university. The university has graduated more than 900 physicians since 1981 through a joint program with the UCLA. Next year, Charles Drew will start its own medical school in the hopes of training even more culturally competent doctors like Leggett. Sometimes the difference between great care and a patient slipping through the cracks can come down to who is in the room, research shows. A 2020 study, for example, found that Black infant mortality in the first year of life is halved when treated by a Black physician. But in California, Black doctors have for decades made up around 3% of the state's total physicians. The nationwide figure is 5%, according to a Georgetown review study, compared to 14% of the country's population. One reason the study cites for the shortage of Black physicians, a lack of medical schools that serve Black students. Of the country's 102 historically Black colleges and universities, only 6 are accredited to operate medical schools, but a recent push for medical equity and diversity has opened pathways for more accreditation. Many African American medical students are interested in treating African Americans. Founded in wake of the Watts riots in 1966, Charles Drew trains nurses and physicians and assistants and offers specialized residency programs, in addition to the joint medical degree.